Hello, everyone. For our health promotion program assignment, we will discuss about workplace burnout initiative. This presentation will be delivered by Desiree Davis, Shahida Begum, Kelly Klotz, Shahid Amuda, and myself, Arifudin. In the next 20 minutes presentation, we will discuss about what is burnout, and the purpose of our initiatives, smart objectives, marketing strategies, how we deliver the message to our target audience, rationale behind our health promotion program, our initiative plus the supporting literature to support our initiative, need assessment. We will also discuss about how we identify people and then the level of burnout. Theoretical underpinnings, proposed evaluation process, and lastly is the implementation and evaluation. So what is burnout? As a side in today's news, I will play about 1.5 minutes video, really in the beginning, to provide information what burnout really is, and then what are the symptoms until we can identify someone is having a burnout.
Burnout, it's not just a figure of speech anymore. It's actually been declared a legitimate medical diagnosis by the World Health Organization.
It is officially defined as a syndrome resulting from chronic workplace stress that has not been successfully managed. And there are three main symptoms.
Here they are: feelings of energy depletion or exhaustion, increased mental distance from one's job or negativity and cynicism related to one's job, and reduced professional effectiveness.
Check, check, and check. No, I'm kidding.
So as we can see, the burnout basically is defined as a chronic stress that one cannot manage. And generally, it has three symptoms. One is a feeling of energy depletion or exhaustion. Two is increased mental distance from one's job or negativity, and cynicism related to one's job. And last one is reduced professional effectiveness.
The purpose of our workplace burnout initiative is to educate organizations and employees on health promoting behaviors, to reduce stressors in the workplace, to minimize negative effect on health and well-being, and eventually improve work productivity.
With our health promotion program, our objective, we are using a SMART objective. So specific, measurable, attainable, realistic, and then time frame. We are specifically targeting staff members who are suffering from burnout or are at risk of burnout. We measure our initiative program based on the decreased report burnout by 5% after year one. And we also modeling adapting our initiative of other evidence-based initiative to ensure success. Burnout is a leading psychological occupational hazard found in any improperly managed professional environment, negatively impacting the workers and the organization. The time frame of this health promotion program, after 1 year, we will evaluate the impact of our initiative to determine if we have met our measurable objectives.
Our marketing strategy is called Marketing Mix. Marketing Mix is conceptual framework of social marketing, and social marketing is the use of commercial marketing concepts to promote behavioral change in the customer. So customer in this case is the employee that we are creating an intervention to help them reduce the burnout in the workplace. So marketing mix has 4 core framework or concepts. So those core framework are called 4 P's: product, price, place, and promotion. So product is the intervention we are trying to create. In this case, is called mindfulness. So mindfulness, and the next one is the price. So price is the sacrifice the employee is are willing to make or have to make to use this intervention. So in this case, it is free. So, but the employees still have to invest the time. They have to they have to go through some pain to be able to achieve the change that they're trying to achieve. So this is the price or the cost for the employee. So the place is how is this intervention will be available, to the employee? How are they going to access it? How easy is it going to be? Is it going to be in the office or with a video? In this case, it's going to be in the office and on the video call to make it easy for them to access this intervention. Then the promotion is how we want to make it easy for the employee to to know about this intervention or this initiative. So, like for example, is there any individual session for someone that cannot attend the group, or is there any the group also? Some people like to attend in group. Is there any kind of incentive for anyone that complete the initiative? And maybe then let them know through distribution of flyers, post it somewhere in the break areas, and all sorts of things that can be done to make this initiative more appealing for the employees is the promotion. And we think this is very important because the employee must know about this initiative for them to be able to use it. So we have to market it to them. That is very important.
It's important to address burnout in the workplace because it is related to an individual's mental health. Burnout often affects the entire workplace and can lead to severe consequences, such as depression, substance abuse, and suicide. Burnout is a leading psychosocial occupational hazard found in any improperly managed professional environment, negatively impacting the workers and the organization. Burnout has been examined in several empirical studies and defined by authors with the consensus that it is psychological syndrome consisting of three key dimensions, such as emotional exhaustion, depersonalization, and reduced sense of professional efficacy. In health, just in the U.S., it costs employers on average $530 billion a year because of poor employee health. Cost includes worker absence, chronic conditions, impaired performance, and workers' compensation.
In our health promotion program, addressing burnout in workplace, we select mindfulness as an intervention. There are three that we decide. One is yoga and meditation. We decide yoga and meditation because it helps workers in enhancing stable psychophysical well-being and do not require a specific environment. Number two is support group. Support group utilizing a problem method is an expensive tool that has been found in addressing work stress related and burnout. And lastly is a micro breaks or mind breaks.
In theory, mindfulness-based initiatives are relatively new in the sphere of workplace health promotion. While young in concept, research shows strong benefits of employee health associated with the use of mindfulness initiatives in healthcare occupations. For example, Klatt et al. Found that mindfulness interventions promoted non-judgmental awareness and acceptance of feelings, thoughts, and sensations among employees. Additionally, practicing yoga and meditation were associated with improved physical and psychological well-being and resulted in improved sleep quality while reducing feelings of stress and burnout. Another benefit of utilizing a mindfulness-based health initiative is the sense of community that it can build within the workplace. Interventions that created social support groups for their employees aided in reducing the rates of emotional exhaustion, cynicism, and depersonalization. A specific example of this is the 2021 study by Green and Kinchin, which found that nurses that participated in these practices were deemed to be more compassionate and experienced improved resiliency and emotional regulation. Finally, implementation of microbreaks, or 10 or fewer minute rests throughout the workday, helped provide a mental reset and replenish energy in employees. Each of these studies shows a different aspect of the many benefits that reduce burnout in employees and potentially improve their health and well-being.
To identify individuals burns out, the level of one's burnout, our group decide to use a Maslach burnout inventory survey. The MBA strategy works to identify individuals burnout at workplace and as a way to redefine burnout. The survey consists of 22 questions assessing 3 areas. One is emotional exhaustion, which is related to the occupational stress dimension. Number 2 is depersonalization, is the consequences of emotional exhaustion, which is considered job detachment and closeness. And number 3 is personal accomplishment associated with the effectiveness and efficacy of an individual at work. This muscle burnout inventory MBA survey has been studied for over 80% of burnout studies. Some of the questions related to muscle burnout inventory survey related to emotional exhaustion, they will ask how we feel emotionally drained by our work, how we working with people all day long. This level will be divided into 5 levels: 1, 2, 3, 4, and 5. And the personalization as well. Questions such as, do I feel or do I look okay after certain patients or clients impersonally as if they are objects? Or do I feel tired when I get up in the morning and have to face another day at work? And then lastly, related to personal accomplishment, a question such as, do I accomplish many worthwhile things in this job, or do I feel full of energy? After finishing 22 questions, it will be divided into 3 levels of burnout. The result of MBA strategy provide information on individuals' physical and mental well-being. The result divide individuals burnout into 3 levels: high, moderate, and low. Okay. Focus on emotional exhaustion. If the result is more than 27, or the personalization is more than 10, personal accomplishment is 0 until 33, it will be categorized as a high burnout level. If emotional exhaustion falls between 19 to 26, the personalization falls between 6 to 9, and personal accomplishment fall between 34 to 39, it will be categorized as moderate level of burnout. And lastly, if the numbers is below 18 for emotional exhaustion and below 5 for depersonalization and more than 40 for personal accomplishment, it will be categorized as low burnout level.
We will be using the principles of complexity theory to design a framework to guide the development and the implementation of setting appropriate initiative activities. Complexity theory allows us to better understand systems as diverse as cells, human beings, ecosystems, and organizations. We specifically picked complexity theory to guide our initiative because it highlights the dynamic and relational properties of a particular setting and those aspects that enable the people in it to organize themselves into new ways of working, thinking, and relating. This is particularly relevant as the healthcare system is a very complex system that is made up of different departments and different individuals that collectively come together to serve their patients. So we need to understand and work with and within the environmental and relational characteristics of the healthcare system if we are going to implement an initiative to help the individuals within the system. In addition, the more the system is interconnected, the more complex the system. However, the system is still capable of adapting to change no matter how complex. To give our initiative additional structure, we will also use the Workplace of Wellbeing Framework, also known as the WOW framework. The WOW framework was developed from the complexity principles, so it aligns seamlessly with complexity theory. Current literature on tailoring healthy workplace initiatives has identified 8 interrelated domains that may have an impact on a workplace's ability to self-organize into new patterns of behavior over time, known as the WOW framework. The application of the WOW framework can be applied to a healthcare workplace setting as it is appropriate for the unique system dynamics, culture, context, and relational aspects of the healthcare workplace. If applied properly, WOW framework leads to an understanding of its local characteristics and can guide the design of a healthy workplace initiative. Essentially, the WOW framework will guide the understanding of aspects of the interrelated context, culture, and dynamic nature of the healthcare workplace setting that enable or block the dynamic ability of a social system to self-organize into new patterns of behavior. In addition, the WOW framework supports data collection from local settings and guides analysis to understand the local dynamic and relational properties of a complex social system. Thus, the WOW framework can inform the development of intervention and initiative activities likely to support local workplace behavior change. Thereby, the activities developed in our initiative are led by local needs, are setting appropriate, and are supported by an understanding of how the local setting can be enabled to support the implementation and sustainability of our initiative. The 8 interconnected domains of the WOW framework are illustrated in the figure shown here. These 8 domains are aspects of the workplace that should be considered when seeking to understand the unique nature of a particular workplace to aid setting appropriate and setting sentient.
We chose to use the PROCEED model to evaluate our workplace health promotion initiative. PROCEED is an acronym for Predisposing, Reinforcing, and Enabling Constructs in Educational Diagnosis. This model, also known as the PROCEED model, is an evidence-based participatory model that involves all stakeholders in the evaluation process. In full, this model creates a blueprint for building and continuously improving health promotion initiatives. The PROCEED model is specific to health promotion initiatives and encourages buy-in from employees, allowing them to be involved in the planning process of an initiative that directly impacts them. By utilizing this evaluation process, employees can play an active role in determining the interventions that work best for their work environment. While there are various phases within the model, we are focusing on the evaluation processes as listed here. The evaluation phases that are utilized in the PROCEED model are the implementation phase, followed by the process evaluation, impacts evaluation, and outcome evaluation phases. To start, we will look at the implementation phase, which is essentially the design and conduction of the health initiative. In this phase, we will work with employees to determine the type of health promotion initiative they need and begin education of the strategies to reduce burnout through mindfulness practices such as yoga, meditation, or micro breaks, and assist in implementing them in various parts of their day. In this phase, we will help educate employees on the harmful effects of burnout and how mindfulness practices can be a great tool for mitigating any potential negative side effects that may be associated with this phenomenon. This phase may decide on a set schedule for implementing mindfulness strategies or just provide continuous education on the various strategies for employees to try on their own. In addition to education, this phase will be a great time to create a support group that will be utilized by employees for instilling a sense of camaraderie and togetherness among the team. The next phase of the PROCEED model is the process evaluation phase, which ensures that the initiative is doing what it aims to do. In this phase, we will evaluate if the program is offering applicable strategies for stress reduction and assess if we are assisting employees in finding various ways to target burnout, reduce stress, and improve productivity in the workplace. We will observe the type of resources provided and their ease of accessibility for all employees. In this phase, we will make note of the areas in which our initiative is not meeting the expectations that we set in our planning processes. In the impact evaluation phase, we will assess if the initiative is having the impact that was intended on the employee groups that we are working with. In this phase, we will assess if there is an actual decrease in burnout symptoms and stress among the employee population and if any positive effects are noted amongst the group, such as an improved emotional regulation or replenished energy. In the final phase, or the outcome evaluation phase, we will assess if the initiative is leading to desired results of implementing a health promotion initiative. As we mentioned previously, we aimed to create an initiative that was attentive to the needs of employees, reduce spending on employee healthcare, receive and utilize feedback from both employees and the leadership team, and improve overall staff retention. In this phase, we will ensure that the initiative is meeting the desired goals, and if not, make adjustments that will aid in hitting these goals moving forward.
Thank you all for your time and attention. Here is the list of our reference that we use for our health promotion program addressing burnout at workplace. Thank you.